Okay, good morning everybody. So first, for all the technical stuff, is everybody ready with their recordings? Set to go? Excellent. Before we get started, perfect. We've got ourselves unmuted. So first, I'd like to welcome everybody here. Thank you for your attendance, both stakeholders and our media partners. We're going to read a few short statements to start out with from a couple key stakeholders, and your media release that you have is a full information on the media release we'll be sending out directly after this is over. And to mention, we've got Dr. Amy Person on the line with us. She is the county's health department health officer. Got to make sure I get this correct. She's attending remotely. Thank you, Amy. Can you hear us still?
Yes, I can. Thank you for giving me this opportunity to attend.
Excellent. Also on the line, we have a representative from Skyline Hospital. Can you still hear us? Oh, there's somebody on the line. Oh, they're both from North Shore? I'm sorry. Can you introduce yourself?
I'm Diane Matthews, Chief Nursing Officer from Skyline Hospital.
Do you have a statement you wanted to make? Do you want to sit up here with us? No? Okay. Perfect. Then on the line, my mistake, we have representatives from North Shore Medical Clinic with us. Can you still hear us?
Yeah, this is Lady Horst. I'm the RN down here, and I believe Cindy's on the line, our clinic administrator.
Wonderful. Thank you. And as I said, I'm Jeff King, the Emergency Management Director for Klickitat County, and for this incident, I am the Emergency Operations Center Manager. And I'll let the others introduce ourselves. Go ahead, Mr.
Mike Cannon, Mayor of Goldendale.
Scott Kohler, Emergency Management Program Coordinator.
David Kavanaugh, Public Health. Jim Sen, the Public Information Officer for Klickitat Valley Health.
So can everybody on the conference with us hear all of those voices, or do we need to speak up a little?
I could hear all the voices. This is Amy Person.
Okay. So yeah, our microphone is at the center table here, so let's make sure that we speak loudly enough and everybody can hear.
Excuse me, Jeff. Your gentlemen, these gentlemen are with the county?
That's correct.
Okay, thank you.
So I'll start out reading from the press release. The Klickitat County Health Department, Klickitat County Department of Emergency Management, local hospitals and medical clinics, and first responders are working together to prepare for the COVID-19 disease. Communication has been ongoing between the health department and emergency management for over 2 weeks. The county's Emergency Operations Center was activated to level 2, partial activation, on March 3rd, and is working to ensure that local stakeholders have the access to all relevant information in these preparation efforts. Now, David has some comments.
Yeah, so public health is really hoping people can be responsible with their own health and stay at home if they are sick. And if you are experiencing, shortness of breath and respiratory problems, we are asking that you call your provider first, so that they can be notified ahead of time. And then, if you're having a medical emergency, also to call 911, and we can assess from there. And then currently, both hospitals and medical clinics are working closely with us in communication, just so we keep an open dialogue. And then the current process is the Public Health Department is determining the medical necessity for testing, only because commercial testing locally is not currently available to us. And it will become increasingly available in the near future. I just want to add that piece there. So I think with that, I think we'll hand it over to KVH real quick.
Yeah, to reiterate what David said, this is a public health department-led event. We are actively working with our community partners to ensure the readiness both internally and externally. Our staff has been undergone training, we've done mock drills, and we are definitely very prepared for this event. For information, we are updating our website as often as needed with information that we receive from the Public Health Department in conjunction with the state. We're also posting that to our social media at Facebook. And right now, we are concerned with keeping our staff and patients healthy and working with the public department as they are leading the event.
So in general, the Klickitat County Department of Emergency Management's mission is to prepare both responders and the community for disasters. And we do that through a myriad of programs and activities throughout the year. We encourage everybody to go to our website and our Facebook page for more information, but most of all, for any emergency or disaster, be 2 weeks ready. And if you are that for yourself, your family, your pets, then all of these things can be managed better by you and by the responders that come to help. And with that, we'll open it up to questions. Yes, Lou, Old Mill Sentinel.
Yes, thank you. How does this response measure to previous responses, for example, with SARS in the past, and how would you compare it with previous incidents such as that?
That might be a good question for Dr. Person, who's kind of really close-knit with the state DOH and other local health officers to assess the
And obviously,
current outbreak.
And I'm asking about on the local level, not nationwide, but here in the county. So.
Okay. Well, I mean, locally we do have some emergency response plans in place that mirror SARS, and if COVID gets to that point, we'll be using those plans and then tailoring them to COVID-19 and then assessing the situation at that time.
So is this comparable to measures that were done, for example, during the SARS outbreak?
I wasn't here personally for the SARS outbreak, but Dr. Person might be able to talk a little bit about how it's very similar.
Okay.
If she wants to add anything.
Sure, thank you. I wasn't the health officer for Klickitat County at that time, but what I can say is in terms of the measures that public health has been taking both locally and state and nationally, I believe this more closely mirrors how we responded during the H1N1 epidemic in 2009. So it's those types of activities that we have been doing, absent the ability right now to have a vaccine for it. But it's making sure that our hospitals and our clinic partners, are looking at the appropriate isolation and precautions they need to take, looking at what our resources are, and then looking ahead to what are the kinds of non-pharmaceutical interventions that we can use to keep communities safe. And that's why we have been messaging a lot and talking a lot to people about staying home when they're sick with any kind of signs of an acute respiratory illness. That's to help us keep hospitals and clinics available for people who need that elevated level of medical care. So I think it's our experience probably from the H1N1 epidemic that gives us the best comparison for what we need to do for this. Both SARS and MERS, while they were a similar virus to COVID-19, we did not see the type of spread of infection in our area. It was much more localized internationally, so I think the experience here is more like a flu epidemic rather than a SARS or MERS epidemic.
Thank you.
And so to your question on the local level and preparedness at the local level, for this event, what we've been doing besides speaking for emergency management and the Emergency Operations Center is making sure that all the stakeholders that are involved in the preparedness and response to the COVID-19 situation is to coordinate that flow of information and keep everybody informed that is working on this at the county level, as well as try to prepare and provide for local responders personal protective equipment if we have a case or a potential case that presents itself. We changed our emergency medical dispatching protocols for call taking and dispatching back on January 31st of January at the direction of the state 911 director to include the appropriate questions of a caller to first identify whether they've traveled and if they have any of the relevant symptoms, and if so, then to notify our local emergency medical services responders, both at the ambulance district and at the fire department level, that they should take the appropriate personal protective steps. We have since upgraded that twice, and once was just yesterday, to make sure that we're providing the proper call screening parameters according to the International Academy of Emergency Medical Dispatching, as well as our local medical program director who oversees all EMS responders in the county, Dr. Smith, to make sure that when we dispatch our local EMS responders that they have the best information going into a call and they can prepare and protect themselves as best as possible. And then that information from the field responders gets relayed to the hospital emergency departments if they come inbound with this potential patient.
You made reference to protective equipment. Does the county have that?
We have some, and we're working on getting more. It is in short supply worldwide, but there's a process, and that's part of the reason, besides just coordination and information management, that we stood up the EOC so that we could start taking those resource requests from local agencies, determining whether we can provide any of those locally in county, and if we can't, then we forward those requests up to the State Emergency Operations Center for follow-up, and if they can't provide it at the state level, they reach out to other states, and if they can't get it there, then they reach out to the federal government, either FEMA or Health and Human Services, those folks. But at this time, we have not needed to move anything up to the state level yet. But we're working with not only our emergency medical responders, both the ambulance district and the fire districts, but also with local law enforcement. They've started taking precautions, having personal protective equipment available to them if they are to come into contact with a suspected person, as well as the sheriff's office for the corrections officers in the jail, and to have the proper PPE if they have an inmate or someone that presents in the booking area with signs and symptoms. So the general message for the public is that we are working behind the scenes right now, all of us stakeholders that are here, to make sure that we're fully informed and prepared if we do have a case that occurs in our county. Yes, question?
I have a couple of things. The first one is, have you had any or much communication with the Dalles, Oregon, and the first responders over there?
Yes. Yes, as emergency management director, I've been communicating with my counterparts in both Hood River, Wasco, and Skamania counties, as well as our Region 8 partners in Washington, which include Yakima County, Benton County, Walla Walla County, and Franklin County.
Then my other comment and question, as I was looking at my health care, I'm an employee of the county, so I was looking at some of my health care and read the information from Regions, and they have expanded the refill on prescriptions in case people need to have a 2-week quarantine. So I just want to share that information. And that if testing was required for them, for anyone, they would be covering that as a basic, just a health coverage that we have. So
Yes,
I don't know
wonderful.
about Medicaid or Medicare or any of that, but there is one health provider that says they are providing that.
Yes, and so that's part of our 2-week ready message, is make sure you have all of your own prescriptions and so on. And I have been reading at the federal and state levels that they're making adjustments to insurance policies, as well as the medical providers that are writing the prescriptions are allowing people to refill in more advanced time, so they have more on hand at home to be prepared for that 2-week preparedness direction that we're giving them. Thank you. Any other questions, comments?
I think you said you're at a level 1 response right now.
Level 2.
Oh, you're level 2 now?
Correct. The EOC is a level 2 operations, so that is partially activated, and we're also mostly in a remote operations, so that people don't necessarily have to be in the emergency operations center physically in person, but they can, via email and phone calls and conference calls, video calls, just like we're doing now. We keep in constant contact. We have the staffing currently is the EOC manager, the situation unit leader, the PIO, Public Information Officer, and then Emergency Support Function 8, which is Public Health. And that is represented because this, as a public health event, this is led and managed primarily by the Klickitat County Public Health Department. And a lot of that information about who's involved with stakeholders is up on the board here. But I think I covered all the basics. Did I miss anything?
We're at talks today.
Does that level?
Oh yes, sorry, I almost forgot. I did forget that we're adding a logistics section chief later today to start helping me manage the resource requests that come in from our local responders for personal protective equipment.
Does that level include authority to, for example, cancel public events, large gatherings, school closures?
Well, that's a great question, and I think we're going to defer that to Dr. Person because that's really under her jurisdiction.
Sure, thank you. So there is a progression of steps that we take as necessary, again, under those non-pharmaceutical interventions. First and foremost, we always rely on what people will assist us by doing voluntarily. So we have no cases in Klickitat County at this time, but if you look for the experiences in Kings County, when they're identifying cases, asking individuals to voluntarily quarantine or isolate themselves is always our first step. If we see infection spreading, particularly if there is what we call sustained community transmission, like has been seen in South Korea and in China, then we would be in discussion with schools or businesses or people holding those events to really look at, do we need to do this? Certainly, at the very highest level of need or progression of the epidemic or the pandemic, yes, there are measures that public health can take that would include closures, cancellations, or even cordon off areas. That's not something we anticipate needing to do, but we understand that if a pandemic were to spread, there are measures we can take and authorities that we can use but we always prefer to do things in cooperation rather than by mandate.
And that's what we're seeing done across the state already. I don't know if you've seen the reports of schools being closed in the Puget Sound area. One entire school district, 36 buildings, closing for up to 14 days. That's all voluntary. The school districts can make that decision for themselves. As you know, the governor declared a state of emergency last Saturday, so that allows certain things to be done in that realm if need be. But right now, everything that I am hearing and getting situation reports from the State Emergency Operations Center is that all of those things are being done voluntarily. Some public gatherings have been canceled or postponed on large scales and small scales, and individual businesses are working to manage that for themselves, up into having as many people as possible work remotely from home, so on and so forth. And lots of folks in the private sector and the public sector are looking at how they can incorporate this event into their continuity of operations planning. So to make sure that if multiple people in their organization become ill all at the same time, that they can still conduct business. And from my perspective as the EOC manager and emergency management director, that's one of my concerns, because at the local level, our first responders, not only emergency medical staff, but also law enforcement, and my own 911 communications officers that I manage upstairs here, as well as at each one of the hospitals and their ED staff. We don't have an overabundance of staffing on a normal basis anyway. So if a certain percentage of our folks become ill all at one time, or if they become exposed and then have to be quarantined as a precaution, then that will compromise our ability to function normally. And that is the biggest thing that I am, as the ESA manager, trying to make sure we avoid, and so that we are prepared to don the PPE, have it available, and don it as appropriately, and make sure that my 911 call takers and dispatchers are notifying the EMS folks, and then they can notify the hospital staff to take those precautions before, like we've seen in other cases, even up in the Puget Sound area, where 19 EMS and firefighters respond to a call, and they're all working the medical call, and then at some point they determined this is a potential case, so they had to quarantine all 19 of those emergency responders, and we don't have that many people to spare, so that is one of our focuses.
For KVH, how many testing kits, or do you have testing kits available in the hospital? Under what circumstances would they be used?
Sure. So we do have testing available. We have not conducted any tests at this time. How they will be used will be in conjunction with the current criteria from the Public Health Department. So whatever their whatever their protocol is right at this time is what we follow to determine testing. Ultimately, it's led by the Public Health Department that they will determine whether the test is conducted or not.
How many kits do you have?
I don't know right off the top of my head.
So for the mayor,
Yes.
is there something on the city level equivalent to the state of emergency that was declared by the governor? And if so, what would it take for that to be a possibility?
If we will be listening to public health officials, Jeff, and our County Department of Health for their advice. And if it's something where cases are growing, we'd be very diligent in letting people know not to interact, but to take care of themselves, all the standard procedures that you have usually even with a common cold. But also what I will hope to encourage people to do is check on your neighbor. If your neighbor has been sick, by telephone. Don't go knocking on the door, but by telephone. And at the same time, if you become sick, let some of your neighbors or your family know so that they can check on you. It's a very hard thing to do quarantine. We're used to being next to each other, and we really have to have some distance if this is so contagious, and it is.
I want to respond, Julian, real quick. Again, there's not a kit per se, and even the testing, how they're conducting the testing has changed within it just the last few days. But the necessary items for testing we do have, and we are able to do the protocol to get the test from our facility to the University of Washington right now, who is our partner in testing.
Is it a blood test or what is it?
It's a
Nasopharyngeal and oral.
Pardon me?
Nasopharyngeal and oral pharyngeal test kit. So, and then, I'm sure Dr. Person can provide a little more detail on that. My background's not clinical, so if you have any questions regarding that process, I'm sure she can add to it.
Do you have a follow-up?
Well, I'm just hearing so much about these so-called quote testing kits, and that doesn't really exist.
It's not a kit. As David is stated, it's a
Procedure.
A procedure, oral or nasal swab that it is then taken care of and transported in a certain way to keep it valid for when it arrives at the testing facility.
I'm sorry, go ahead.
Yeah, so I think a lot of people are hearing nationally that, test kits are available, that kind of language. Well, what they're referring to is the ability for local hospitals and local labs to do their own testing. That's really what they're referring to when they talk about making it nationally available. When they say test kits, right now it's kind of swabs that get shipped off from whatever provider is doing the testing.
So the point is that there are limited facilities available that can do the test that would detect this virus.
Correct. Yep.
Yeah, the kits are being made available to the labs.
Yeah.
The samples are being taken at the provider level and then shipped to the labs to be processed through the testing kits.
What is the turnaround time?
Layman's terms.
That's difficult to put a gauge on because there's a number of tests going each day. There's limited capacity at the state level to do the testing, and that might be a better question for a representative from the state DOH to really put a gauge on.
It's Ms. Dr. Person. What I can say is that the turnaround for an individual test can be within hours. The challenge that we're facing right now is that the current capacity of the state lab does not exist to run hundreds or thousands of tests per day. So that's where the challenge for the capacity has been. As more private and commercial testing labs become available, then we'll be able to do larger batches of those more frequent runs, and then we will be able to get test results sooner. Testing right now, in terms of the timing that they're being run, is being prioritized to, areas of highest need, and that generally are things that involve healthcare facilities, outbreak investigations, such as King County is dealing with right now at a long-term care facility. What I think is important for the public to understand is that testing or not testing doesn't affect our ability to treat or manage patients. Individuals who develop COVID-19 who have mild disease are going to treat themselves the same way they treat themselves if they have any other acute respiratory illness, which is going to be rest, it's going to be fluids. If they're running a fever, it's going to be medications to help relieve the fever. If they are in that group of people that seem to be susceptible to more serious illness, which right now includes the elderly or people with underlying chronic medical conditions, then those are the ones that are requiring the additional support in our hospitals. But that's the same additional, this is another one reason why we are asking people to stay home if they only have minor illness, because we really need to reserve our clinical and our hospital capacity for people who need that level of care. We're all looking forward to the time when testing capabilities will be more widely available, because I think it will help us to understand that the majority of people who have COVID-19 are not that sick. I think right now the picture looks scarier because we have to prioritize testing for our sicker patients. So those are the ones that we tend to see the worst outcomes in.
Am I correct in assuming that cases that are reported as COVID-19 are cases that have actually been tested to confirm that? And if that's accurate, how did anybody know who the first people to get this were? Because presumably they didn't even know enough about it to have a test taken.
It was second first again, so correct. What's being reported, these are people with laboratory confirmed COVID-19. I think you do raise an excellent point, particularly as we have continued to learn more about this pandemic, both from the international experience and even from the experience in Washington. It is looking likely that the first case of COVID-19 in the state may not even have been the first laboratory confirmed case, which was the gentleman in the Homish County. And that's because we do have many people who can develop COVID-19 infections and really have very mild symptoms. So they may not have realized they had anything different from the cold or the flu. Again, that's why it's important that if people are sick, that they are staying home. We don't expect that we will stop this infection from occurring in our communities. Our goal with our planning and our preparation and our working closely with the hospitals and our clinics and our first responder community is to try to slow down how quickly this infection spreads through communities so that we can maintain adequate health care supplies and resources to manage those that need the additional supportive care.
I don't want to hog up all the time.
Go ahead.
Is there truth to the report that we've heard that some people who tested positive for COVID-19 got over it and then contracted it again, apparently?
Who's that person? I am not aware of that report.
Well, it's a Facebook rumor, so that's...
Information comes
I would say those are unconfirmed reports.
Yeah.
Nothing officially has come to us through the state or federal level indicating that is the case.
At the grocery store this morning, I saw an occurrence that made me think about this on a broader level. The manager at the grocery store was talking to a cashier about handling money. And she was extremely concerned about, I don't want to have to handle bills because they're covered with germs. And he was trying to talk through some workarounds which don't seem to exist. But has that ever come up? Is that any kind of concern for people to be thinking about handling money in public places? Which I guess would be the only place.
Well, I mean, when it comes to money, that's pretty dirty. There's probably other things on there that are worse than COVID-19. But I think, there's, being diligent about washing your hands and being diligent about, you can even use the hand sanitizer with 60% alcohol base. And, they might even consider if they want to don gloves. That's a possibility as well.
The main thing in that circumstance, for a worker like that, handling not only the money, but anything
Right.
between people, is then not to touch your face until, whether you have gloves on or you just wash your hands or use hand sanitizer, is don't touch your face. It's transmitted through the droplets, and mucous membrane is the way it gets into you. So yeah, gloves or hand sanitizers, and don't touch your face until you clean your hands. Correct?
That's spot on.
For KVH, we hear about a lack of respirators and maybe even a lack of hospital space. How are we fixed locally for that situation?
We are prepared for COVID-19. We have all of the PPE gear in place for our employees. We have a stock of that as well as backup. We have isolation rooms set up in our ED, as well as a protocol in the clinic should a case be presented that we feel is warranted for a public health department call and investigation. We also have protocol in place that we could cordon off rooms in our acute care to hold patients depending on the public health department's direction. So KVH is completely prepared for this event.
And I'll now give Skyline the opportunity to answer that same question.
We're the same. We have counted up, we have all of our surplus locked up, pull out at any time, but in the meantime, on the floors, we have all of the isolation gear they would need, the N95s. We also have PAPRs for people that can't fit the N95, and we have notes on the doors, any type of respiratory. We're working with North Shore. If they see a patient, they call up and let us know. So we're all ready to go to answer it. The note on the door says, please let us know right when we let you through the door, because we have a locked door, that you do have a respiratory symptom, and we go out in the gear to meet the patients. Inpatient-wise, we have a negative pressure room in our ED, and we also have one on the floor. And so we're set.
What is that?
That's for airborne. It brings the air from the outside in, puts it through a HEPA filter system to go out. And so we use those for airborne respiratory people. So we are equipped in that way. As everybody else, we have a limited number of staff, and so we're really being diligent about protecting ourselves because we don't have extra staff. We've looked around. We've put the messages out there through agencies to let us know if people are available in case we would need it. I think they're all being taken lots of places at this point, but we're prepared for the patient, and patients that are there, it will be determined if they're safe to go home early, and then if we need to discharge and make the whole unit, that type of thing. So we do have a long-range plan to look over everything else.
Thank you. And North Shore, you're still on the phone. One of you want to address that question?
Yes, this is Lainey, the RN, and while we don't have a negative pressure room because that wouldn't be a common occurrence in an outpatient clinic setting, we have put in place protocols for patients, front desk, provider staff, and medical assisting staff to ensure that our patients are directed to arrive in a particular manner and they are not sitting in the lobby awaiting care. We've been able to dedicate one side of our clinic for visits that are related or visits that are pertaining to patients who are complaining of fever or a new cough or new shortness of breath. So they're not intermingling with reception staff or lobby staff or patients who are coming in for routine medical care. And so our approach has been to separate that patient population, and then we've been coordinating with Skyline Hospital, as was previously mentioned, to ensure that the patients understand how Skyline would like their arrival to occur. And we're also communicating with Skyline staff in the event that we send a patient their direction, either for emergency treatment or outpatient x-ray or laboratory studies. You know, if we're looking for white count or something like that, we do let Skyline know to expect that patient.
Yeah, I say overall, for us at KVH, if there is suspected, the call ahead to us is, so important. So we can, again, much like White, Salmon, and as well as North Shore, that we have a protocol in place to meet the patient outside. And then, we have negative pressure rooms as well, and a whole protocol in place to deal with them. But yeah, keeping anybody suspected outside the facility is, of paramount for everyone's safety, including our staff. We're in the same situation of needing to keep everybody healthy so we can manage care when it's needed.
And the other patients in the facility.
Absolutely.
It's high priority.
Absolutely.
What is the quarantine capacity of Klickitat County if we should have a worst case scenario?
So in hospital, you mean?
Well, anywhere.
So-
I suppose self-quarantine would be the
Yeah.
first
Yeah.
step.
So quarantining
That's the
at
first
home.
step. Yeah,
It's-
it's quarantine.
The patients that would rise to the highest level of medical care are the ones that are going to need to be in the hospital and quarantined in the facility.
What is the capacity?
Sure. So we are able to dedicate 4 rooms on our acute care floor to quarantine with that negative pressure. It would be up to the public health department in conjunction with us about how many patients it's safe to hold in those rooms, but we have 4 rooms in acute care that we can safely cordon off and can be quarantine rooms as needed.
Skyline?
We have the one negative pressure room on the floor and one in the ED, so we could do 2. But if you're, depending on the literature that changes every day, whether they need to be in that, I also have a unit behind locked doors that I could add an additional 2. It's locked on all ends, so it would be separated in that area if we needed. But if we get to that point, I think we would really look at who are we really keeping in the hospital and who are we transferring to a different area for their safety? And is that what we need to do? Do we transfer the COVID-19 patients somewhere if there's room, or do we keep them and transfer the other ones into a lower care area? So that has been discussed, and if we need to get there, we'll do that.
All great questions. Any more? I would like to go back to Lou's question about declarations of emergencies locally. So as the emergency management director and David as the interim director of county public health department, we have been briefing the county commissioners and the mayors on a regular basis. It's my responsibility as emergency management director to let them know, keep them advised of the situation, any kind of emergency situation in our county, and then give them recommendations on whether we should make a declaration of an emergency or not, either at the county level or at the city local level. So we had a very fortunate happenstance that we were having training scheduled for this Wednesday already with all of our elected and appointed officials to talk about the incident command system and emergency preparedness. So we took that opportunity to go deeper into the COVID-19 event and what that meant, so we can all be on the same page and be prepared. But at this time, with no positive cases in our county, we're in the preparedness and readiness phases. But if it comes to that, we are fully prepared to take the steps that are necessary to protect the public.
And at KVH, we have a hospital incident command system set up. We meet every morning with that team to review any new news from public health, any questions, any situations that may have arose, any protocols that need to change based on direction from public health in terms of testing or other things like that. And so we feel we're very prepared and we're proactive every single morning in that team meeting. Annie Stone is our incident commander there. She's also our medical director, our director of our clinic operations. And so in terms of that, we have that system set up to work in conjunction with the public health department and Jeff.
And we have had calls into 911 that have resulted in alerting first responders to don their PPE and people that have come to the hospitals. All of those cases have been worked through and screened out so far. So we have been doing this process. People have come with, symptoms that may be related to COVID-19, and we have successfully dealt with all of those from the EMS level all the way to the hospital level currently.
Have you had to test anybody
We
yet?
have not tested anybody at this moment.
Locally, we've tested one person.
And
We're pending results right now.
So one more big picture question. It seems that in the beginning it was you're likely to get it if you have been in contact with somebody who's traveled to China or something, a situation like that, where there was immediate possibility for contagion. Now is it accurate to say that it can and will occur just spontaneously out of anywhere for any reason? Is that accurate to say?
I think Dr. Person would
Yeah,
be the best one
yeah.
to answer that.
Sure. That's not quite accurate to say. Initially, the infection arrives here via travel. What we're seeing now is what we call community transmission. So there were likely people who had traveled prior to when the travel ban and screenings have been implemented that arrived in communities. It's also likely that there may have been people who were exposed and unaware. What we're seeing now is what we call community transmission. So it is not arising spontaneously, but people in Seattle or Kirkland or Grant County or Los Angeles or Illinois or Texas or any of these places where we're seeing it, they are acquiring the infection from people in that community who have been infected. And this is what we will see as the infection progresses. So it is likely we will see many more people getting infected, but it is also likely that we will see most of those who do get infected will recover without any problem. But right now, we do know that you don't need to have traveled or even to have been in contact with a lab-confirmed case of COVID-19 to develop that infection.
Thank you.
you said you tested one person. Can you tell me if that was a travel-related or a community situation?
Dr. Person can answer, probably best answer that question.
Dr. Person?
Yes, that one, we, based on the initial screening, we did not identify any immediate travel risk factors. We are awaiting those results, at which time, if it were to be positive, we would be doing a much more extensive contact investigation.
When are those results expected?
Again, that's really hard to put a gauge on, but hopefully soon.
And what's important also to remember with this, Dr. Crystal did, is that our healthcare facilities are taking all the necessary measures needed in order to protect that individuals, to protect staff, to protect patients. Clinics are always taking all of their necessary precautions. The community is. So we know that we are keeping people safe. And again, people can help us out as much as possible by staying home if they only have minor illness symptoms.
So, to ask a kind of a summing up question, the steps, and correct me if I'm mistaken here, The steps are, if you think you're getting sick, first step is quarantine yourself, get yourself out of circulation for 14 days. If it looks, second step is if it looks more serious. Did I understand you to say go to your medical provider, or do you go straight to the hospital, one of the hospitals?
Contact your medical.
Sorry?
Contact your medical first. Yeah,
Oh,
call
contact,
in,
okay.
discuss your symptoms, and then from
Do not
there-
go in person, contact
Yeah,
first?
Contact
Okay.
first, yeah, again, we don't want, if we can keep you outside of the facility and mitigate it that way prior to bringing you in, again, by virtue of how this spreads, it's in the best interest of patients and
So
staff.
do not rush to the emergency room.
Right.
Yes, exactly.
Unless you're experiencing a
Unless
true
you're-
medical emergency,
Right,
then
right,
dial
Yeah,
911.
if you're presenting significant symptoms, respiratory distress, at the point of really,
If you're in fear for your life.
yeah, if you feel that you need to see a provider, then please call in advance, present those symptoms, be honest about your symptoms, in entirety, be honest about any travel you've done. If you know you have been in contact with someone, please let the facility know that. And then from there, our protocol will go into effect to meet you outside the facility and take the necessary steps for safety.
Okay, and that magic window does seem to be 14 days, is that right?
Yeah, 14 to 21, I believe, is what they're saying now.
Okay.
But I also want to reiterate that it's really important that you do call ahead because we are a small county with limited staff, and we don't want to see what we saw, like Jeff was alluding to, where they had 19 EMS staff get quarantined. So we hope that the public, the information, or the big piece they take away is if you're having those symptoms to call ahead of time first.
Okay.
So as a layperson and an emergency preparedness person, I see it as the things that public health has been preaching for decades, right? If you think you have the cold or the flu, first thing to do is stay home and take care of yourself so you don't infect your coworkers or the public. And secondly, should be to isolate yourself even inside your home from other family members so you don't give it, don't share. But if those symptoms persist in a way that you believe that your condition needs medical care, then call first. And even if you don't call 911, but you're coming to a clinic or to the emergency department on your own transportation, call ahead and let them know that you believe you have those symptoms, and then like I said, take care of yourself at home. And we're also we aren't, but other counties and cities in our state are asking businesses that if their people show up sick to work, to send them home, because that is the respectful and right thing to do. It always has been, but people think out of a sense of dedication and whatever that they need to be at work. Now is not the time to have that attitude, as well as all the social norms of shaking hands and the things we do, especially as rural communities and tight-knit communities, people that interact often, one-on-one. Just forego that right now, so we can limit the spread of this to a greater number of people at any one time. That's the real, from my perspective, where this could really have an impact in our small communities. If enough people get sick, not even needing hospitalization, but then take themselves out of the workforce at any one time, then that compromises not only public safety, but the economic heartbeat of our communities. So don't overreact, but take it seriously and take the proper precautions. Is that a good sum up? Any other questions, comments from our panel? Thank you for being here.
Thank you.
We'll close it. Oh, sorry. Go ahead.
Yeah, I'm sorry. This is Lainey, just from North Shore Medical Group, speaking on behalf of our entire group. I would just really like to acknowledge and thank both Klickitat County and the County Health Department staff for their excellent communication and coordination with all of the local healthcare providers. been a very busy time, and they've been doing a fantastic job.
Thank you.
Thank you.
Yes, thank you. All right. Have a wonderful day.
Thank you, Dr.